So, guys, we have another great one here with you guys. Oh my God, I'm already messing up. So, hey guys, we have another great one. We have Lisa Bryant, the burnout at the bedside. Lisa, can you tell us about yourself and how long have you been a nurse?
Yeah. Um, I'm Lisa. I've been a nurse for 19 years. Like, I think my anniversary is next month already.
Oh wow.
That time has flown by. I'm originally a small town girl. Grew up in a little rural pocket of North Dakota. And when people from other parts of the country say that they grew up in a small town, I'm like, what was your
How small?
graduating class? Yeah, because mine was 8. So I think I have you beat. There's no, the school is now a community center for the, like 57 probably residents that still live there. But it was a good, safe place to grow up. But nobody, unfortunately, not a lot of people stay, as you can imagine.
Hmm.
So I went to NDSU in Fargo, which is kind of the biggest city in North Dakota, for nursing, and then stayed there and started my career in the emergency center. We were a level 2 trauma center at that time, busy, just like everywhere
Hmm.
else, crowded, length of stay, left without being seen, all of those things. Um, and spent a little over 6 years there and did a few different roles. I was a service educator and clinical supervisor and preceptor and charge
Hmm.
nurse and trauma nursing instructor, and moved a couple times for my husband's career. And
Hmm.
so that's kind of how I pivoted into more non-traditional roles. And our family grew. We have 5 kids from
Oh
ages
wow.
4 to 19. So yeah. Yeah.
Wow.
Mhm.
Lots to unpack there. So,
Yeah.
you transitioned to work from home after how many years?
Oh, I have only been working from home. Well, I've done a few different things from home. So after like 10 years or so is when we moved to Minneapolis
Okay.
area, like Minneapolis, St. Paul, the suburbs though. And I stayed home with the kids and just worked very casually, like in a
Hmm.
non-traditional sort of work from home but home visit role,
Okay.
doing so in our state we have personal care assistant programs that to try to support people staying in their homes, but that requires a nurse to oversee like care planning
Hmm.
and doing annual home visits and working with the people that provide that direct support to the clients. So
Hmm.
that was super flexible. I just worked like a few hours in the evenings or on Saturdays, and we had no childcare. And that was like my first stint of like holy crap, like nursing can be so flexible for whatever
Hmm.
stage of your life and whatever you need. And then I wanted to get back into full time, and so I had experience in inpatient case management. I was a director and had spent a year doing like med surge detox inpatient
Okay.
case management. But I wanted like that is a grind too. Inpatient case management, you learn a lot
Yeah.
really fast, but it's busy and high burnout there
Yes.
too. So I pivoted to primary care coordination, and it was a little bit of a hybrid role because I was a supervisor of a team, so I could kind of touch down from home a little bit, but I was at the clinic a few days a week too. And then moved into a system care management role called the clinical product navigator. So you have all these different insurance
Hmm.
choices out there. And people don't realize that like when they choose the cheapest one per month, that's because they're choosing a care network. And if they go outside that network, they have really high out of pocket expenses, or in some cases no coverage. And so that's kind of where that role came into play, is making sure that members who chose that use their benefits as they were intended and weren't misusing the emergency room. And we talk about measuring that, in terms of total cost of care and avoidable ED utilization. And I did that for 4 years. And then quality kind of always was a thread of care management on the inpatient and outpatient
Hmm.
side and really interests me. And so well, it'll be a year next month that I pivoted to ambulatory quality improvement consultant. So That's looking at data. So, you have to report
Mhm.
to insurance agencies and CMS and the Department of Health and your state and on provider outcomes, clinic outcomes, care system outcomes. And in this role, we are looking at how are we performing as compared to our peers. And the goal is obviously to be a top performing medical group, and so if there are areas of opportunity where we're kind of below benchmark, then that's where my team comes in and says, like, let's process map this and see where the pain points or the gaps are, and how can we get us up to achieving or exceeding performance benchmarks. And for things like, you probably have heard of HEDIS, for example, like that's
Mhm.
one big data set, but then other payers have certain priorities that are important to their population, like the Medicare Advantage, health insurance
Yeah.
payers. A lot of things are important to them that are not as important to a Blue Cross Blue Shield plan that is for, you know, ages 21 to 48, most of their demographics. So it's kind of playing all of those nuances on the business side of healthcare, and driving improvement that impacts clinical performance.
So, lots to unpack.
Yeah.
So, how long did it take you to be what your IG name says, burnt out from doing bedside nursing?
Yeah. Um, I think, gosh, I would say I didn't feel like I was burned out in the ER, after
Mhm.
6 years, but rather our girls at that time, we've added 3 boys since then, but they were starting to get into school and activities, and I was having to miss,
Oh, yeah.
and so that was sort of the catalyst for that. And then I spent 1 year doing inpatient case management, and that
Like,
was
just
a catalyst for burnout, kind of. Yes, like, because they just want you to get those patients out, and I understand why. Because coming from
Mhm.
the ER, if there's a delay on the inpatient side, there's a bottleneck in the ER, so I
Yeah.
totally understand why. But on the other side of the hospital, there's not a lot of community resources, and so just trying to, like, use a magic wand, we would say all the time, like, they'd be
Someone will
like,
get 'em out.
so and so is clinically ready to leave. And yeah, you're like, let me just pull my magic wand out and create that TCU bed for him. And he doesn't have any insurance to pay for it. Like, you can't do those things. And so, but then after that, I spent 2 years as the director of case management and utilization review. And I loved that job, but when we relocated to Minnesota, I knew that, again, for family reasons, we couldn't both, my husband and I, have two kind of competing high stress jobs, and I was on maternity leave, so I was like, let's just make a plan to live off of your income and until I find what's next. So that's what we did. And but that's about the time. So to answer the question, I would say, like, I don't know, 9, 10 years maybe, until I was like, I don't think I can go back to that inpatient setting in any capacity. So
So from then on out, if I got it correctly, then you were pretty much hybrid for a while and then slowly got into a full, like, work from home type
yeah.
job?
Yep.
And how did you find the work from home jobs?
Intentionally, that's what I always tell people. Like, first of all, like, you don't have to sometimes look far. I've
Mhm.
been with the same organization for over 6 years and have made a couple of pivots that have been, either hybrid or remote. And so, yes, there are, like, national companies that hire remote healthcare workforce, but if you live in a state that has their own health insurance plan, or you live in an area that has, a larger metro health system or systems, chances are they have roles that are remote, and they may not have at one time, but
Mhm.
just like everything else, the pandemic shifted a lot of
Yeah.
that. Frees up office space for them and capital to be, to invest differently. And yeah.
Yeah, I've been seeing that more and more, a lot of more people shifting to work from home, which until I started interviewing people, I didn't really know much about it. Then I already talked to maybe 2 or 3 people doing work from home nursing, and they seem to love it because of the time freedom, and you don't have
Mhm.
to commute to wherever your hospital or medical center that you're working at. So, like, just from a broad spectrum, like, what are the I guess, pros and cons of being a work from home nurse?
The pros are kind of just what you said, that flexibility. When I was commuting, it was
Mhm.
probably like on a perfect traffic day, 45 minutes one way. And so then you have to leave your house sooner to drop your kids off at before school. You're paying for that before and after
Yes.
school care. Um, and so like that is the biggest, I would say, pro is the flexibility and the time and money savings just for those few things. I would say the con is if you still love like that direct, like if you still get gratification from direct patient interaction, there's not as much of that. Some of the
Mhm.
roles, yes, like when I was a clinical product navigator and in ambulatory care management, we would talk on the phone, and sometimes I would make an arrangement to meet patients at, a clinic visit or something. So there's a little bit of an option, but if that is still like a primary benefit of yours, that would be a con to maybe working from home.
Yeah.
And I hear also, I've listened to a few of your podcasts that people are taking pay cuts. I'm like, I
That was my next
I did not
question.
have to do that, and I that would have been a big con for me.
That was my next question. So, now that you went into it, how did you have to negotiate, or that
Yeah.
was so right from the beginning, you're like, "This is what I need," and tell me your process on how you didn't have to take a pay cut.
Um, so when I got that director of case management job, Um, I didn't like we had moved for my husband's job. I started as an inpatient case manager, and within like 2 weeks the director left and the VP was like, "I think you come from that great hospital system with really good experience from the ER and case management. Would you take the director job?" And I was like, I didn't even really think about it. I just like said yes and I accepted the offer and I got home and my husband's like, "Never accept the first salary offer." Like
Yeah.
they're not going to the worst thing they're going to say is no, but like you could always get probably 5 to 7% more. And
Mm,
so I was like, note to self. And
yeah.
so every time that I have taken a role, I have just made it a point to like very tactfully and professionally kind of explain why I feel like my experience and skill set as compared to what the job requirements are, maybe are different. And so I appreciate the offer, but I would like to counter whatever. Do they always take like what I request? No. But every time that I've done that, I've gotten something more than was first offered. So
Oh, wow.
yeah, that is
So
something I encourage everybody to do.
and, like, we talked about it with, the other people I interviewed is, I guess that negotiating skill isn't taught, or just even asking, sometimes you feel bad asking.
Yes. Right.
So, like, how do you I guess you had your husband, help you out with just, like, "Just ask for the next one," or it kept in your head that from that first time. So how did you have, like, the guts to just ask for every role to be like, "I think it needs to be higher than this."
I think you have to like you do have to step away from like your people pleasing tendencies, and I think
Mhm.
as nurses we tend to be like non-confrontational too, and almost view that like negotiating as a confrontation when it's really just a
Mm.
conversation. And so again, the worst I think if you come at it with like, "I want more money," that's different than like planning. Do your homework. Like what is the market rate, and ask what the
Mm.
range is. And because I think from an organizational perspective, their goal is to hire candidates, but also like protect their bottom line, quite frankly, right? So knowing what might be going on in their head too, and kind of just using again like a really thought out process to leverage a little bit of that negotiation.
So the research comes into play of, I guess, like you said, the job description, seeing what they have listed there and seeing all the boxes you check off should come into play when negotiating the salary for that role.
Right. Yep.
And oh, you were about to say something?
Oh, I always encourage people too to ask about like total compensation. A lot of nurses are like zero point 0.8 or zero point 0.9 FTE, and a lot of these work from home roles are 1.0 FTE. And then you need to look at how much am I spending in health insurance benefits? How much will you pay at the new company? Like kind of all of those things. And some roles and companies offer bonuses too. So I would encourage them to ask the question, like, on average, like, how often does this position typically hit that bonus target? And is the bonus target, like, can you exceed it? Can if my efficiency or performance or whatever exceeds like that target, can I max out?
Yeah,
So
I've only started hearing people talk about total compensation instead of just like whatever number salary it is, because it does come down to like the healthcare and if there's a match and all the other benefits that you brought up. And I was like, wow, that's actually huge. And for me, I'm in like a union nursing job, so I don't even like notice that. But
mhm.
then for everyone that I'm talking to regarding negotiating salary and all that, they start bringing up, oh, you have to start looking at that big picture of everything that's involved because that could sway you one way or another on taking the job or not.
Totally.
And then, so we were talking about like resumes and picking up the job descriptions, and then we could go into what you do outside of your. Are you still working as a work from home
Yeah.
nurse
Oh, yeah. Yeah. Full time. Yep.
full time? And then now you have this little side hustle that is all about helping nurses get hired for work from home jobs. And can you tell us about that?
Yeah. I finished my master's in healthcare administration last year in 2023. And in doing that, learned like we're headed kind of almost for a disaster in terms of like resource need and resource shortage in healthcare.
Mhm,
And nurses are, as you probably know, burning out at an alarming rate and then just leaving the industry. Like this is happening in, 3 years, 4 years, 5, 6 years of being a nurse, and then they're just totally changing gears and leaving healthcare altogether. And I feel like it's partly because we just aren't taught in any sort of job orientation or systems approach, and certainly not in school, about all of the different opportunities. And so I've helped tons of former employees of mine and existing and former clients, like with resume writing and exploration of careers and stuff, and just decided kind of the catalyst for making it a little bit more intentional was all of the learning that I had in my healthcare administration program, and wanting to nurses to use that education that they work so hard for and know
mhm.
that it doesn't have to be in a role in which they sacrifice either pay or um, burnout, but rather they can find flexibility and fulfillment and use their skills in a way you know, that they probably never even imagined.
So what are like the biggest things that make people not get hired for these work from home jobs?
It's a process. I think that in pre-pandemic there wasn't as much awareness and there
Mhm,
wasn't as much opportunity either. But since then, I think that there's been this like huge shift and drive and desire to find work from home jobs. So I
mhm,
think what holds people back is not following a process. Like you need to be on top of your game and follow the companies. I always say, like, go right to the company website. Some of them will allow you to set up a job profile. So even if they don't have an open role right now, but you are really interested in working for them because you've read about their culture and their benefits, see if they have a virtual hiring event. Like, see if they have a LinkedIn page, follow them on there so that you can stay up to date when a new job is posted. And if they allow you to set up a profile right on their company website so that an email comes right to your inbox when a role that matches your interests, that is like a shortcut, I feel like, too. So that's like step number one, is like is
yeah.
finding the right companies that interest you, that have roles, and then maximizing your effort to try to stay updated when those roles become available, because it's not uncommon for over 100 people to apply. So you want to be early and you want to be on your game then when the time presents itself.
So, like, another question that I usually get from I ask the question to them, the work from home nurses, what kind of like specialties can you go into? I don't even know if specialties is the word. Because like there's so many different types of work from home nurses where I feel like it just gets grouped all into one. So it's like, how do you find a job that you might actually like when there's not a lot of people that even know what work from home nursing is?
Totally. And that's why, I have like a guide, right, that I
Mhm,
created, and I have like I think a page and a half worth just of titles so that people
mhm,
understand. And I think the best way is to do your own homework then. Pick out a few job titles, go on LinkedIn, search for those job roles, use your Google to get an understanding as to what would that role typically entail. And
mhm.
after reading it, does it excite me, or am I like totally turned off by it? And put those ones aside and then narrow your search to focus on the ones that really do intrigue you. And I
Uh,
say too, if you don't have experience, create it. Create it for free.
hmm. If you don't have experience, create it.
Yeah.
Can you go into that a little bit? Because
Eh,
like I feel like that would help a lot of people.
Yeah. Um, so there's, free online programs. I sent out an email last week, I think, to my clients and said, hey, like Coursera, for example, you
Mhm,
can do a 30-day trial. And so ahead of time, do your research. If you're really interested in quality or risk management or care management or disease management, see if they have courses. Make a list of all the free ones, get your free trial, and then take some CEUs. Like carve out time so that you can add some skills and experience on your resume to like maybe narrow the gap a little bit. So even if you didn't function in that role, you at least can speak to a deeper understanding of knowing exactly what that role might entail and how your current experience, can be a match and like close the learning.
that's huge. That's like a no one talked about that yet, like, creating that type of value for yourself so you could put it on your resume, get some CEUs, certification, whatever it may be, pad the resume to make you more help you stand out, I guess because everyone just looks at the resume first before they interview you, at least that'll help you get to where you wanna be.
Hmm.
That's
I
that's
I think leverage your network too.
Mhm,
You know, um, Before I got my current role, I had been interested in that
mhm,
department, but I also knew, maybe I didn't check every box. I didn't have the level of like we use Lean Six Sigma in
mhm,
healthcare. It's a, defined quality process improvement that might be like required or preferred or whatever it was. And so I reached out to the leader of that department and was like, hey, really interested in an opportunity on your team. Could I have 20 minutes to speak to either you or someone on your team that you'd identify? I'd love to learn more about what a day in the life looks like. And then I took notes and I followed up, and I encourage people to do that too if they have the opportunity within their existing organization, is to, again, you don't have to sometimes look very far, but use your network too and that's a super high impact free way.
and you also said that you didn't have to, like you're with the same company for a few positions already, so you
Hmm.
don't necessarily have to switch companies to find another job, and with those changes in like those, pivots in your career, were you still able to also negotiate different salaries every time you went to a different one?
This last time I felt like the offer was fair. So I didn't, but every other time I did. And like, for example, I started just as a clinic care coordinator, and there was some restructure that went on. And so within 3 months, there was an opportunity to be a supervisor. And I think that they offered like 1.5% extra. And I was like, you can't fool me to like have people responsibilities for that. And so I requested 10% and was super nice. And I ended my email just saying, I kind of organized like why I felt I was asking for that so that it was legitimate. And then also said, totally respect that if there's not an opportunity in the budget or the pay grade to allow for that type of increase, then I'll just continue in my role and be a key individual contributor and be very happy doing that for the organization. And then they came back with the 7%. So that was a lot better than the 1.5, So again, if you don't ask, and then you just think about exponentially, then every time that you
Mhm.
get an annual cost of living increase, it's going to be on
Mhm.
top of that higher mark that you asked to begin with. So
And then I'm gonna share my screen here. Let's go into your stand store really quick here. Can I open it? Share. Cool. I did it.
okay.
So because of what you just talked about, writing the emails, is that anywhere in here as well where you teach people how to respectfully ask for a raise?
Yep. So, like, literally everything that you would need that has been helpful for me and the other people that I've helped is in that comprehensive remote starter guide. So,
Right here.
companies, job roles and titles, how to write a resume with templates, cover letter examples, interview Q&A, and a sample like negotiation counter offer. So like when it gets, like again, I talk about the process, right? So from start to finish, like tips and prompts and examples for that whole process.
And this is awesome. So let's start from the left side first. So for the free stand out and get hired, what do you usually get from after you download that PDF file?
It's like 3 pages of content. Like there's kind of 9 steps that
Mhm.
some people may be like, oh, this is so obvious. But I think others are so burnt out that it's just almost a flippant decision sometimes to like rash apply to a bunch of roles. And I think it's so important for us to understand why you're even thinking about looking and then figure out what it is again that would fulfill you. So if you need to talk to customers and clients and feel kind of gratified making an impact in a clinical situation, then I'd recommend triage or care management. If you're tired
Mm.
of that like high volume customer interaction and that burden, then I instead would recommend like a data abstraction role or maybe quality improvement or clinical risk assessment because you're a little bit more autonomous and working independently and not so much volume and customer interaction. So kind of it steps through those things like figure out why and what, and then you need to be on your game about where to look and looking often and tailoring your resume to and make sure that it's sharp in your application and kind of all those other sort of more basic tips that then are that's 3 pages that are like expanded on fully with like full examples and detailed supportive tips in the remote starter guide.
And before we get into all the other um, products that you have here, what made you decide to start putting out products to help people get into work from home?
So I didn't originally think that it was going to be that. I thought it was going to be a little bit more of I don't know, like a professional development type of
Mhm.
page. Just how do I ask my leader for some time so that I can maybe shadow in another department and gain critical experience or have a tough conversation about promotional opportunities or, like those types of things, as well as how to optimize LinkedIn and your resume interview skills just more broadly. And then quickly, everyone was interested in how do I work from home? How do I work from home? And so I pivoted more to target the resources, some of them
Mhm.
just to that.
And that's awesome. So going back into this resume and templates writing guide. I know none of us are really taught this. Like we're just like, oh, just figure it out and put all your experience on your. What are your biggest things for writing a resume?
So I think keep it concise and outcomes focused.
Mhm.
I always say like a hiring leader should know that if you're coming from the CVICU or the ER or med surge, they know that you have technical skills. They
Mhm.
know that you can, zero an art line or, that you're good at like balancing different priorities and, documenting clinical assessments. But tell me a little bit more about the type of outcome that your unit or your organization was impacted because of your skill set. And I think everyone is part of improvement work and they don't even realize it. You know, when
Mhm.
there's a new initiative that gets rolled out on your unit, a new policy or a new protocol, you were part of that bigger initiative. And so, what were the results when you did a fall prevention program? Did you guys reduce falls by
Ah.
50%? You know, like, so think about the things that the unit has done that you as an individual also contributed to, and like, tell me a little bit about that. Um, if you're really seeking like a non-traditional or
Yeah.
advanced or remote role. And then I also think it's important to demonstrate a little bit differently in a skill section some of those soft skills that are highly transferable and have a big impact. So tech proficiency, like, tell me a little bit more about data entry and data analysis and effective communication, multitasking, all of those different things. So
Yeah.
that guide kind of walks you through the importance of that, but then also has pages of like transferable skill statements that you might consider and a couple examples of outcome statements. And then also comes with three templates. So you can walk away with kind of that knowledge, but then apply it and build build yourself a resume.
And I'm assuming not a lot of people like writing their own resume, and that's why
No, they
you
don't.
have the next thing where it's you'll write it for them. And
Yeah.
I'm sure, like I talked with Phil, he was one of the first work from home nurses, and he says he's done a few, and he's like, this is really tedious work, and it takes a while sometimes because sometimes people don't even send you almost anything that could be translatable to a work from home job. So again, what what do you need as the person that's going to write the resume for whoever's looking for the job? What do you need specifically from them to make it the best that they could have?
hmm So if you get that product, then it comes with an email that kind of outlines the instructions. And I need to know what it is, what jobs you're most interested in, so that I can kind of,
Mm,
tailor some of your personal outcome statements and skills to the jobs that you're most interested in, and what would be most valuable to those roles that you're applying for. And then also, yeah, I follow Phil, and he and I sometimes message back and forth too. And we both raised our prices, let's just say that, because I think it was like a proof of concept thing first. Like, you know, I want to redo some and then, you know, show people the difference, um, really tangibly. So I have a couple of reels that kind of demonstrate
mhm.
how, you know, the difference. Um, but yeah, they're tedious because again, everyone's looking for a different maybe role or niche that they want to seek, and then everyone comes with very different backgrounds, experiences, length of experience. And then on top of that, yeah, I did a travel nurse one once and I was like, whoa, this is really like, you know, because so much good experience, but the assignments are like, you know, worth 3 to 4 months in length. And sometimes they would work for the same company, but maybe take 8 months and work for two different companies in the meantime and then go back to that one. And so
Oh,
it was like, how can I make this flow efficiently? Without having like so many unique like segments on here. And so that one challenged me a little bit in a good way. I learned from it, that's for sure.
and, like, you also don't want, like, a five-page resume from
No,
no
you
one's gonna
don't.
wanna look at that, right?
Right. Yeah, exactly.
And then the one-on-one mentorship, what's included in that? I see their resume revamp, LinkedIn audit, and then looks like you one-on-one job search and suggestions with them.
hmm So that's like 3 Zoom meetings, and then that would include kind of upfront, like what are your goals? What's your timeline? And then let's make it like kind of a base resume and a base cover letter for you that we can maybe easily adjust as you go and learn things or new roles come up that interest you, but also teaching them how to optimize LinkedIn and set it up and make some connections. So each of those Zoom sessions would have just a little bit of homework before the next one. And then the goal is to like walk away really confidently, having heard, seen, and done a few of the steps that are outlined in that remote starter guide. So for someone who's a little bit more wants a little bit more hands-on, that's what the one-on-one mentorship is.
Awesome. And like I was just talking with other work from home nurses, like I didn't know LinkedIn was huge in getting jobs because n- none of us floor nurses use LinkedIn at all. Like we probably made it when we originally applied for jobs and never updated it since. And apparently now, especially for work from home jobs or even informatics jobs, I
Mhm.
guess that counts too. They're like, it's all about using LinkedIn.
It is. Yep.
And how do you even revamp that? Because isn't it just like a resume on social media?
Kind of. It is kind of a resume on social media. So you want like your summary section. I always tell people to be like your elevator speech. So like if you were meeting someone, they asked you like, what do you do? And it was a potential
Mm,
hiring leader, like how could you give them a 30-second spiel that would be a home run? Like all the things that you do and you're about and might be able to benefit their organization. But a little bit more, I would say the experience sections can be a little shorter than a
mhm.
resume, just a few kind of outcome statements because LinkedIn also lets you put skills on
Yeah.
there. And so that's really nice too, because a lot of those skills that you can add are keywords from job descriptions,
Mm,
like data analysis, utilization management, utilization review, software, certain software like Interqual and Milliman. Those are two kind of industry standard guidelines that you use in the review of like utilization management. So um, that's how I encourage them to set that up is really maximize like the skills that they have, make that really nice summary statement, and then turn on your bio. Like if you're open to work, there is a section in the profile that you can click that says open to a new job. And then it cascades
oh,
into additional questions about kind of your timeline, your location. So if you're specifically looking for hybrid, remote, on site, or if you are open to all of those, if you want full time, part time, PRN, and then that you can also turn it on so that it's only visible to recruiters. So that it's not
oh, wow.
awkward for the world to see that you're open to work in case you didn't want your friends or
Oh,
your current employer to know. You can turn that on so that it's just available to recruiters. And I read something recently like 87%, up to 87% of recruiters will use LinkedIn for jobs that even haven't quite yet been formally posted. That's not
wow.
industry specific, but just a statistic. So, yeah, I can't underscore the value of leveraging LinkedIn.
I didn't even that wasn't even on my map before because every now and then I think I'm like, oh, would I rather work from home? I got kids. It'd probably help out not having a 45-minute to an hour
Mm,
drive to work and then another 45-minute to hour drive back depending on traffic. So it's like 14, 15-hour days. And I was
yeah.
like, it would be nice to just roll out of bed, turn on my computer, and start working from there. So that's always been a thought for me and my wife to, because she's also a nurse, to potentially go into this. But now talking with you, talking with other people, LinkedIn seems to be a huge thing, and then rewriting resumes. I don't even know when the last time I even updated my resume
Yeah, I
was.
know.
That
If you're a bedside nurse, it's just like not even really needed, like until you do kind of want to go non-traditional. I'm sure for the first 6 years of my career, I didn't touch my resume either.
and then thinking about, like, resumes, because every now and then, they ask the staff nurses to check, like, help interview the next potential oncoming staff nurse, and then you see someone else's resume, and I'm already turned off by, like, front and back ones where I have to, like, flip
Hmm.
pages. And then when I start reading it, they still list, like, all their college experience. I'm like, "I don't care about your clinicals.
Yeah,
Where
right,
did you work?"
right.
Eh, so, is that something, like, you end up taking off as well? Like, only work experience is needed for these work from home jobs kinda thing? Like,
Hmm.
why are you showing me college things that probably didn't matter?
Yeah, totally. I think, the relevancy, it's like a reverse chronological order. I think that's still the best format for a resume. Start with what you're doing now and then kind of work backwards
Uh,
and only including things that are relevant. So, if you've been a nurse for 27 years too, we don't really need to know 27 years ago that you started out in med surg. Like, tell me about the last 12, and then we can talk
Mm.
during the interview in that, sort of cliche question, tell me about yourself. Then you can walk us through a little bit about your journey and how it started. But we're going to focus on the relevancy of your recent experience as it applies to what I need today.
So I know we talked about like the pros and cons of working from home. You, you said you have 5 kids, right?
Mhm.
And how does I'm assuming, I'm just going to assume, how did you do the childcare with the younger kids while working from home?
Oh, the 4-year-old goes to daycare full time. And I think people who think that they can work a full-time work from home job and have young children at home is misleading because
Okay.
you are working,
Yeah.
like I have meetings, I have commitments, I have projects, I have deadlines, and having young ones at home who also need attention and have other needs and supervision, all of that, it wouldn't work. But the other kids are older, they're like 9, 11, 16, and 19, so
So they know
they
not to bother you during work
yeah,
hours.
yeah.
So like, yeah. So I guess that's what I wanted to get into because I have a 3-year-old and a 2-year-old.
Mm,
So that's really close in age and they're super young. So as glamorous as a work from home job would be, you'd still at least you would save on the commute to work,
mhm.
gas, toll, parking, but there would still be an expense for babysitting. And I think that just needs to be highlighted for the people that think that just because you're home working doesn't mean that you're not working, you know?
Totally. Yeah, absolutely. And we would have to maybe until like this coming summer, I would have also probably had to pay for some sort of summer programming for the boys.
Mhm.
But being home has allowed them, like, I give them some structure, or they carpool with some neighborhood kids to their summer sport camps and stuff like that. And so that still is a savings, and same thing with before and after school. So once they get to school age, like working from home
Becomes
has
easier.
mhm, yeah, yep.
That's huge. And I know we went over a lot because is there anything that you wanted to go over with working from home and trying to figure out people's places in like the nursing field?
I think I would say just have a plan. Like you'll end up miserable potentially if if you think that every work from home job is the same, and working from home is totally glamorous. And so every single remote job you apply to, you might get yourself in a situation where you are measured on keystrokes and mouse clicks, and like logging into Zoom. I think Philip from did a reel
Mhm.
about that recently. And so you need to do your homework and figure out the right company and the right role that fits what your goals are. Because if you want flexibility and autonomy, then that's a different direction versus if you want a lot of patient care, but just to wear your pajamas doing it. Like those are different things. So I would just say trust the process and follow a process.
Do you plan on staying work from home forever or you're going to transition it into your business?
Oh, I don't think I'll ever do the business full time. I enjoy it. I think what it does for me is allows me to have sort of that leadership influence, that
Mhm.
mentorship of people who are looking for something different and supporting them on developmental growth. But I also love what I do full time. Like I'm really being challenged in my current role and learning a lot of different things that my clinical brain, it takes a while, but it's so interesting how sort of like an engineering process applies to clinical. And so that's intriguing for me. And I don't really see myself going anywhere except there's one other job that like totally interests me, and that's reinsurance. Have you ever heard of
Reinsurance. I have
reinsurance?
not
Yeah.
heard of that.
Okay. I was surprised that in all my years of working in value-based care and pop health and very closely with insurance payers, managed care that I had heard of this. Some of our insurance companies would email and say, "Hey, our reinsurance company wants an update on this member. Like, what can you tell me clinically?" And I'd send off an update or whatever and not really think about it. And then last year, a company reached out to me, again, the power of LinkedIn. I didn't even have my profile as open to work, but they just saw case management, utilization management, managed care, those skills on my resume. And we're like, "Hey, we have a job opening for a clinical risk manager." And it was a reinsurance company. And so I interviewed. It was way more money than I'm making now and bonus, but it required me to go downtown twice a week. And that was
Hmm.
just like a deal breaker for me. Um, but I was super intrigued by what I learned. And so, yeah, insurance companies have insurance. So
Hmm.
if customers or a certain population underneath like a insurance product are reaching claims thresholds, or utilization patterns aren't in line with what they would expect, they kind of have to protect themselves too from having to pay out more than they had strategically planned. And they will send certain instances to the reinsurance company then, who helps cover and protect them from some of that like catastrophic loss.
Wow.
Um, and so they use people from healthcare to help with that segment of their business, because there's reinsurance, I guess, for life and auto and you name it on the type of insurance. So for the health insurance sector, they look for clinicians to help them do analysis of populations, or look for trends, like why are, for example, maybe a certain group of pregnancy and maternal cases are resulting in really high cost or unusual outcomes. Then they would want someone with a clinical background to dive into that. Like, are we doing early inductions? Are we not doing enough prenatal visits, like the recommended ACOG prenatal visits? Looking at those types of things to help then inform them and go back to the insurance company and say, "Hey, we really think that you need to put together a case management program for your prenatal population because they're missing visits, they're getting induced early, and it's costing extra claims."
Yeah.
So kind of marrying that like insurance business clinical piece, that sounded super fascinating to me. And it was something that I hadn't even never heard of, but I'm staying right where I'm at for the foreseeable future because I love my team and my leader is unmatched. So,
And that's really cool that you also brought that up, because you found a job that you love, right? And it I'm sure you liked your other jobs as well prior to, but that also doesn't mean that you have to stick to the one you were at, as you've shown that you hopped around for a while. And I
mhm,
think that's like a hard part, like what we touched upon a little bit earlier, that a lot of nurses are just people pleasers, and they'll stay on like a really trash floor just because, oh, I like my coworkers, kind of thing
mhm,
like that, and they don't
mhm,
look after their own mental health or their own happiness, where there's options out there. You just have to find them, and look, you found something that you're super interested in, that you might venture into later down the line. I know we're going on almost an hour here, so if anyone wanted to contact you and get their resume to you, how would they get in contact with you?
I respond personally. I don't have many chat or any fancy thing set up on Instagram. So if they send me a direct message, a little bit about their situation, and then I would kind of give them some advice or guide them to the right resource in my store.
If you had any advice for nurses that are looking into the work from home, what would be your number one tip for them before looking to work from home?
Give yourself time. So like if it's something that you're even a little bit interested in now, start looking and start building up the steps to the process, because it isn't overnight.
Mhm.
So allow yourself time, and then the ball's in your court if it gets to that point and you get an offer, and you decide that you want to stay where you're at. But if you're even thinking about it, I'd get a start.
Definitely. That was great advice. And Lisa, thanks again for hanging out with me for about an hour here.
Yeah, nice to visit face to face.
Oh, for sure. And thank you for all the tips you've given me already. So
Yeah, reach out anytime. That's for sure.
thanks again. Have a great weekend. And I'll probably be messaging you again for like a follow up later.
Okay,
All right.
sounds great.
Have a great weekend.
Bye.
Bye.